away. Okay. Yes. Okay. I have no idea. Can you see me on the Facebook Live there?
Yes.
That's
It's
okay.
cutting up just the very top of your head.
Is that better?
That's
We're
right in
also
the middle
missing
now.
just a little
All
bit
right.
at the top of the screen, and it's a little catwalk.
Okay, I'll fix that when I go there.
Yeah.
As long as you can see me talking now. Hi,
Yeah.
everybody.
Yeah.
It looks like we're both kneeling.
Thank you for coming. We're going to get started with our healthcare issues at the 86th Texas Legislature briefing. I know almost all of you. I'm Lisa Goodgame with Indivisible Austin, and this is my colleague Laura Garricardos. She is the Deputy Director for Children's Defense Fund Texas, based here in Austin, and she is also one of the lead coordinators for the Cover Texas Now Coalition, which I know some of you have heard me talk about in the past. Cover Texas Now is a statewide coalition of policy, direct service, all sorts of health care organizations, advocacy organizations, and Cover Texas Now organized some number of legislative sessions ago to work on getting Medicaid expansion here in Texas, and has taken on a host of other healthcare policy priorities. So we will hear about some of those tonight and things that these groups are working on at the Texas Legislature, and ways that people from our Indivisible groups and other progressive advocacy groups can get involved in healthcare issues happening at the legislature. What else do we want to say real quick?
I think I'd just be curious of what kind of Indivisible chapters folks in the audience are.
21.
21? Okay.
25.
Okay.
25.
Actually, I'm from Fort Worth, so 12, but I also
Okay.
have some connections down here in 21.
Oh, great. Wonderful to have you here. Did you come in just for this?
I did.
Oh, wow.
Oh my goodness.
How exciting. We have a special guest from Fort Worth. That's so great to have you here.
Thank you.
Are you with the Indivisible Fort Worth Healthcare group, or I know there's a group.
Yes,
Focused
but
on.
no, I haven't worked directly in the
Got
House, but I am working on individual Texas Ledge.
Oh,
in the-
good.
In the organizational
Wonderful.
phase of it.
Well, great to have you here. So Laura has a great presentation for us. She's going to talk about a number of different issues that we have been, when I say we, I also work with Children's Defense Fund as part of my day job. So a number of issues that we've been working on prepping for this legislative session. We're also going to talk about a grassroots healthcare organizing project that we're working on that I think can also be a great opportunity for folks, especially those who are not in Austin. So if you're not in Austin and you're watching this and you're wondering how can I get involved in healthcare organizing at the legislature, we have something for you too. So I think I will turn it over to you and try to fix the wonky live screen.
Thank you, and thanks everybody for joining us this evening. I brought a lot of good information for you. Hopefully it's what you're looking for. And I'm hoping that we have some time for Q&A and discussion at the end as well. Since we did have a 2-hour time block though, I brought y'all a lot. It should cover kind of what the state of coverage is here at the state level for adults and for children. Our legislative priorities for a few key coalitions, as Lisa was saying, and then also just some slides about with information to counter a lot of misinformation out there about Medicaid and Medicaid expansion that just more people should know about and see, so that folks can't pull fast ones on us with talking about Medicaid spending or how the program works and things of that sort. So we'll just dig right in. So you probably know that Texas has the highest rate and number of uninsured in the country. And this is despite kind of historic progress since the Affordable Care Act came. We have 1 million more insured individuals in Texas because of the ACA, yet we still lag far behind other states. That was for the full population. Even when you look at children, however, we also have the highest rate of uninsured children. And there was a big report that came out about a month ago that unfortunately after 10 years of improving on child uninsured rate, we turned direction and started going in the wrong direction just between 2016 and 2017 data. So we saw our uninsured rate here in Texas go from 9.8% to 10.7% for children. And we'll see a little bit later on that the uninsured child rate grew far more in states that had not expanded Medicaid. And that's because there is a connection between parents having coverage and their children having coverage and being able to get care. Just of note, of the 835,000 uninsured children here in Texas, 350,000 of them are eligible for Medicaid and CHIP, but not enrolled. So we still have work to do to make sure eligible children are able to get on the program, and more importantly, as we'll see later, able to stay on the program. This is the national graph for child uninsured rate, and I think what's significant here is that child uninsured rate went up across the country. You know, that's pretty significant. I think it does speak to national policies trying to repeal the ACA, the federal level and the administration and Congress took a long time to reauthorize the CHIP program, and there was confusion around that. And generally, you know, many believe the anti-immigrant policies are also very much affecting this trend. It's notable, though, that 3/4 of the increase in uninsured children were in states that have not expanded Medicaid, like I said before. This slide is shocking to me. I've been working in this area for more than 10 years, and I am shocked by this number. 1 out of every 5 uninsured children in this country lives right here in Texas. And when you look at this pie graph, we are the second largest pie compared to, I forget what the number is, but it's, you know, almost every other state in this country. And only followed by, the next largest is Florida at 8%. % of uninsured children live in Florida, 21% live here in Texas. So we saw, for this increase in uninsured children, we saw that uninsured children grew at 3 times the rate in non-expansion states as compared to expansion states. We saw trends that when parents get covered, children have a much higher coverage rate, and then just some kind of numerical support for that. This slide is showing coverage for Medicaid and CHIP here in Texas. You see the largest pie chart, the largest piece of the pie are children on Medicaid. We have nearly 3 million children on Medicaid here in Texas. When you combine it with the blue pie piece, that is CHIP coverage. When you add those 2 pieces up, almost 1 out of every 2 children here in Texas is covered by either Medicaid or CHIP. So whenever we hear anything about trying to cut either of those programs, we're really talking about coverage for nearly 50% of children in Texas, and the rate is somewhat comparable across the nation. The piece I want to point out here is a lot of times people describe Medicaid as the insurance for poor people, and I have a good colleague that always says, what people? These are children. The large majority are children. Medicaid also covers other vulnerable populations like pregnant women, people with disabilities, seniors in nursing homes. And of adults, it only covers very few adults. First, you have to be a parent, and second, you have to be very low income. Such low income that, for example, for a family of 3, you can't make more than $320 a month. Another way to compare it is if a single mom with just 1 child, if she works more than 11 hours a week in a minimum wage job, she would make too much to be able to keep her health care coverage. So even though our child uninsured rate is going up, it's far better than the adult uninsured rate, which we saw on an earlier slide is at 17%, children's at 10%. If we look at the population between 18 and 64, so before Medicare, but not a child anymore, that uninsured rate is about a quarter. It's about 25% of working age adults in Texas do not have access to health insurance. And this is a pie chart just showing why such few adults are covered. The eligibility, the amount you can make for pregnant women, newborns, children are much higher than the adults. The adults is at 18% of the federal poverty level, and those were the numbers I had just given, or the examples. There's a new report that came out, I just wanted to flag, from a group called the Texas Healthcare Alliance that has the Texas Association of Businesses, the Association of the Rural Hospital Groups, the Texas Medical Association, Episcopal Health Foundation, and I believe Texas Hospital Association that measured the economic impact of not doing Medicaid expansion, which grows more and more all the time. And I think this has a lot of detail that I'll just leave folks to kind of read on their own because we have a lot to get through today. But just the numbers are enormous. We basically bypass about $6 billion a year for not doing Medicaid expansion as a state. This slide, and I put more information on here than we can probably all cover, but just so that y'all would have it and can dig into different parts that may be of interest to you. But you might hear this session people talking about the Texas fiscal cliff. That is referring to a Medicaid waiver, an 1115 waiver that we have and we've had for the last several years, that has helped support our healthcare infrastructure and our hospital infrastructure and given payments to them to help, everybody kind of stay afloat. The feds have said that our waiver will not be renewed, and in fact is on a schedule of kind of expiring over time. So by 2022, just a few years from now, 2 years from now, our hospitals are going to be missing a large chunk of money that they currently rely on. And that is one of the most compelling reasons to somebody who may not care about providing health insurance to the uninsured to do Medicaid expansion. The Medicaid expansions, those $6 billion a year, were always meant to replace and provide this kind of support for our hospital systems. The thinking was that with coverage expansion, you'd have a lot less uninsured, so more of the costs for the uninsured would be covered and hospitals wouldn't need as much supplemental payments. So the last few years we've gotten waivers to continue getting those supplemental payments, but they're going to go away, and essentially many advocates, including the Children's Defense Fund, are saying if you don't go ahead and accept the Medicaid expansion funding, we're going to be in a real crisis here. And of course, hospital infrastructure is always code for this affects all of us, so it's no more us and them than insured people and uninsured people. We all rely on hospitals for emergencies, and in fact, because of this issue of not having the Medicaid expansion dollars to replace expiring funds, Texas has the highest rate of rural hospital closures in the country. And if you look back through the news over the last few years, there are stories of people that have passed away because they had to travel an extra 30 minutes or because they arrived at a hospital that had been shuttered closed. Part of what we've been trying to do over this last year and heading into this session is trying to talk about all the different healthcare issues that are that are impacted and that we can't make the kinds of improvements we need to make without ensuring that people have healthcare coverage. And I'm going to kind of run down some of those different subject areas that are impacted by our high uninsured rate. One is, of course, when we look at children and families, we've already talked that when parents are covered, children are more likely to also get care. And children that and adults that got Medicaid as children were more likely to graduate school, high school, go to college. They be higher income earners and pay more federal taxes, and also be healthier as adults. Medicaid has helped poverty rates go down, and it provides stability in the home. And I like to mention that one because a healthy home or a healthy life for a child is more than just having healthcare coverage. It's about feeling safe, it's about feeling supported, it's about not having too much stress in the home. When a parent is uninsured and they can't get the health care, the mental health care, the chronic disease management help that they need, the family is more financially at risk, and the child is under far more stress at home and has poor outcomes in life and in health generally. For maternal health, I think, oh, darn, I had a slide here. Oh, so sad that it's not here. I'm so sorry. When we send out the slides, there's a slide that shows that our maternal mortality rate is just, going straight up. And we need to take action. There's a lot of attention around this, but 1 in 4 women in Texas of reproductive age do not have health insurance. A maternity mortality task force just did a report. One of their findings was that, surprise, women need access to healthcare coverage before, during, and after care. Many of the reasons for these sad occurrences were preventable and have a lot to do with chronic illness that women are experiencing before often they even get pregnant. For mental health and substance use, more than 1 million uninsured Texans experienced a mental health and substance use disorder in the last year. Of these, 400,000 could get health care coverage if Texas decided to expand Medicaid. And insured Texans are 50% more likely to receive treatment. So it would make a big difference for access to mental health. And probably, for anyone that follows the news, we know that this impacts our juvenile justice system, our criminal justice system that is oftentimes the primary mental health provider in communities. So there's a very high human cost and economic cost to leaving people without access to care. For child safety, 66% of foster care placements resulted from parental substance use, but only 5.8% of uninsured low-income Texans were served for their substance use disorder. So there's extraordinarily low services for people that need help with their substance use disorder. and it causes, again, repercussions throughout our system. So not only juvenile justice, criminal justice, but also child protective services and foster care, all things that come at a huge cost to our state. And, you know, other states that have expanded coverage have shown that treatment for substance use disorders has increased by 700% when you expand Medicaid. So voters support expanding coverage. Polls and elections have shown that Texas voters care about coverage. The Kaiser Family Foundation and Episcopal Health Foundation did a poll just last year, and 87% of Texans believe that increasing access to health insurance is either a top priority or important, and 64% specifically support Medicaid expansion. So, and remember, this is in Texas, so anyone that tells you Texans don't want to expand Medicaid expansion is not paying attention to the data. So now we come to our legislative priorities that we're looking at for this coming session. First, ensure that coverage expansion, well, this isn't really a session one. So our long-term goal is that we want Texas to expand coverage, to do Medicaid expansion or something equivalent to ensure that our low-income adults get the coverage that they need. Our groups are going to keep working on that this session and making the links between mental health and substance use and maternal mortality. But like in past sessions, we have been unsuccessful in getting the support from the top leaders in Texas, so the governor and the lieutenant governor generally. This has been despite getting surprising support in both chambers over the past several sessions for a coverage expansion proposal. But of course, if the lieutenant governor and governor aren't going to support it, it's difficult for a coverage expansion solution to move. So advocates, a number of advocates are choosing instead to focus on building more of a grassroots strategy. So what we saw in the last elections was that making healthcare a priority issue mattered. Having general elections be more competitive mattered. And so we are really thinking about a 2-year plan, looking at the next elections with the goal of making healthcare and Medicaid expansion specifically a top priority. So how can we make it so that any candidate running for office has to at least address the high rate of uninsured and talk about what they would do to deal with this issue and whether they support expansion or not. Children's Defense Fund and many of the groups we work with don't work in electoral politics, and despite building this grassroots campaign, we won't work in electoral politics, but we do recognize it as a moment where communities are particularly concerned and engaged, and opportunities to raise the visibility of this issue. So part of our message today is we want to form a healthcare network across the state with local healthcare leaders that are connected to us and provide us the opportunity to work in tandem to give local elected officials and future candidates the message that healthcare matters, you know, in each local community across Texas. So if you would like to be part of that kind of network and helping organize your community, which could be anything from petition signing, block walks, meetings with an elected official, social media strategies, please, my email is at the end of this presentation, and maybe we can tweet it out or whatnot. But if you email me and in the subject line you put local healthcare leader, I will put you on the list and we'll be having monthly calls. Other states have built movements around this, typically for ballot initiatives that have clearly made a big difference. Some states have done more 501c4 work on electoral politics and built this kind of similar campaign for electing a new governor or whatnot. We think we can build that kind of campaign here, 501c3 through a public education campaign. We can't do a ballot initiative. Most of the folks that work on this are 501c3s, but we think the organizing concept is our strongest strategy. It's where we think we can make the most impact. And another way I like to say it is our legislators are only responding to the landscape. And so our leverage point is to try to change the landscape in which they are responding. And we think that it's already starting to happen and that we can make a big difference if we focus on a grassroots strategy. I want to move on to the other legislative priorities, but if anybody has questions so far, I want to take a quick moment to stop. Now, can we take questions even though it's streaming? I'm used to the streaming.
Absolutely.
Thing. And I have to be a human being for a second and totally apologize if I'm speaking a little bit slower than usual. I think I'm going on 5 hours of sleep with presentations all day long. This is incredibly important to me. I asked Lisa if we could organize something like this, if it could be streamed to try to reach as many people as possible. This has been my work since the ACA passed and the Supreme Court ruled that Medicaid expansion was optional. So I care deeply about this, and I apologize if my tone is a little bit more tired than it usually would be. Question?
On the 1115 waiver, is it possible that the feds will renew that?
Interestingly, it's been the the Trump administration that has said that they won't renew it. The Obama administration was already indicating that they would not renew it. So it's unlikely that they're going to change positions on that, especially because it's been both the Democrat and Republican administration. The Democrat administration's rationale was, why are we making this deal for you to get a much smaller amount of money to pay for your uninsured population when you could get a lot more money to actually provide that very same population coverage? And the Trump administration, I think that they view it as, why are we paying for supplemental payments to your healthcare system when it should be a state responsibility? If the state is underfunding provider reimbursement rates for Medicaid, then the state should take care of that instead of the feds coming in and providing additional funds to make up the shortage that hospitals and providers get for treating Medicaid patients. So it's different angles, but I don't think anybody is expecting a renewal on the 115 waiver.
This might be a little bit technical, but my recollection is that there was a graduated copay that they were doing with the expansion. And so would we come in where Texas is having to pick up at a much larger rate at this point?
Yes, so the question is, doesn't the match rate change over time for Medicaid expansion? The answer is yes. I think the first few years would have been at no cost to the state. We've missed that opportunity. At this point, Texas would probably be looking at the lowest level of reimbursement once we join, but that lowest level of reimbursement is one of the highest reimbursement rates of most federal state partnerships that I've ever seen. It's 90%. So for every nickel we put in, we get $1. We make $1. So we pay a nickel on the dollar.
A dime on the dollar.
That's part of my tired, and obviously I didn't go into business. Yes.
Can you turn that into dollar amount that would have to be funded if we were able to do that this year?
How much it would cost the
Dollar
state?
amount. Yes, what are we asking for outlay?
You know, it's been so many sessions since we got that estimate that I don't quite remember it, but it's not very high. And many states that have done Medicaid expansion have found that expanding Medicaid has been budget neutral or even created additional revenue for the state. And the reason for that is right now we have a number of healthcare programs that provide Band-Aids and patches for different populations. And if we have coverage expansion, you could essentially get rid of a lot of programs that are paid 100% with state dollars for providing just more expansive coverage. There's also, you know, with the provider taxes, additional revenue that actually comes into the state as well. So it's always been an exceptionally good deal for states, which is, you know, why so many have done it. There's only 14 states remaining that have not expanded coverage.
Laura, could you give an example of one of the state programs that if we expanded Medicaid would go away and we would not be making that state dollar outlay?
There's a program for cervical and breast cancer. So, you know, very, you know, honorably the legislature at some point, you know, heard a lot of compelling stories of women who were uninsured and ended up getting diagnosed with cervical breast cancer and didn't get care. And so they created a special program just for that population. You have to have a positive, it doesn't cover preventive checks, but once you get the diagnosis and it has to be just those two cancers, then you're able to enter that program. So that's one example. There's healthcare costs in our in our county jails that also are funded more with state dollars that could be replaced. You know, if we had a coverage solution, we have women's healthcare programs, you know, that provide coverage. That not coverage actually. So the Texas Women's Health Program and the Family Planning Program are great for getting preventive care to women, but they don't provide care for chronic illness or if women need specialty care. So it's not full coverage, but all those kinds of programs that provide pieces of healthcare for populations, in theory, would not be needed if people just had access to healthcare coverage, or at least needed in the same way that they are used now.
So you said that there is support for Medicaid expansion in both chambers of the state.
There has been in the past.
Has been?
I would not say that.
Okay.
Now. Yeah.
So there has been in the past, but there hasn't been consistent support from the top officials. Mm-hmm. So they have access to the same statistics as you do, the same demographics as you do. So what is the official rationale for not wanting to do Medicaid expansion from their point of view? And if it's strictly a political one, that's all you have to say, but
right.
Is there some other like numbers-based rationale that they actually give?
It is political, is the short answer. The typical messages are just kind of an opposition to public programs, to Medicaid. They talk a lot about how Medicaid is growing uncontrollably. It needs to be, you know, the costs need to be cut and dealt with, that Medicaid is a broken program. And I have some slides later to address some of these issues. They also tend to say that the cost of healthcare is growing so much in the state budget that it's starting to crowd out other priorities like education. We'll see in a later slide that we still spend more money on education of our state dollars than healthcare. Often the reverse is said, and that's because they're looking at the all funds budget instead of just the state dollars. So state dollars is just our money. All funds is our money plus what we pull down in federal funds and that much larger budget. Because healthcare, Medicaid and other healthcare programs like CHIP and eventually hopefully Medicaid expansion have such favorable match rates, it balloons the healthcare budget for our all funds budget. And usually that's the chart that's shown and not the just state dollar piece of it. So it gives a very erroneous perception. The idea that Medicaid is growing uncontrollably, usually they look back to the last 10 years when enrollment rates have skyrocketed. Well, CHIP was formed about 10 years ago. That helped enrollment in Medicaid and CHIP, and children got enrolled in a program we created. So it started at 0, and now it has children. That one is very surprising to me. If you look at just the last several years, enrollment has stabilized in children. So it has, now that the program is up and running, now that we've had between 90 to 95% of children enrolled, it has not been growing at exponential, in an rates as before. The other piece to point out here is our country does have a growing healthcare cost problem that we need to address, but blaming Medicaid for it is not the answer, and thinking that we can get a handle on it simply by cutting Medicaid is also not the answer. In fact, healthcare costs have grown slowest in Medicaid. They've grown faster in Medicare and private insurance. So there's arguments and then there's counter arguments. At the end of the day, it is political, and I think the reason general election, people getting out to vote, no matter what party you're in, and the general election being more competitive is it makes all elected officials pay more attention to all of their constituents. When the general elections aren't competitive and a legislator need only pay attention to their primary, then they're suddenly paying attention to a much, much smaller piece of the population and of their constituents. I think that, I'm trying to remember, 10% of people in one of the last few elections voted in the primaries, and about half vote in the Democratic primary, half in the Republican. So there was some crazy number, like only 3% of Texans, in essence, elected our governor. Voting in the primaries is very important, voting in the general elections and getting more people to turn out to vote. Again, no matter what your party is very important for legislators paying attention to all of their constituents. Yeah. So I think that's what we've run up against. We advocates and stakeholders have tried everything under the sun to appeal to the top elected officials, and we've gotten basically, everybody signed on to this idea at some point. Chambers of Commerce, bipartisan county judges, because when people are uninsured, those costs are falling on local communities and to local taxpayers. But because of the politics, there just has been no movement. So again, the strategy we're shifting to is, if they respond to the landscape, let's change the landscape. And we have a goal of getting coverage expansion done within the next 4 years, and starting to build an infrastructure across the state of people actively organized and working on this, and again ensuring that any candidate running for a public position has to talk about this issue. We think is going to make more of a difference than making 100 more meetings up at the Capitol. Any other questions on this? Alrighty. So I'm going to move on to other. So that piece is something I think for us to work in that's a little bit outside of this legislative session, but there are a number of things that we can work on during this legislative session that can make a big difference also. Number 2 here is implementing 12-month continuous coverage for women of reproductive age. So because the maternal mortality crisis is, is really shocking, and people are wanting to work on it, the task force has said that women need really continuous coverage, but at the very least more continuous coverage than what they have now. Right now, low-income women who get pregnant get covered from the date they get a positive pregnancy verification to 2 months after pregnancy, but a lot of maternal deaths and mortality, morbidity also associated with that is happening after the 2-month period, and in the about 1 year, up to 1 year after they've given birth. So there is it's not coverage expansion for everybody, but is this an incremental step that the legislature could support of at least getting moms 12 months of continuous coverage? Here's the chart I was looking for earlier. So you see the red line is going straight up. The blue line is actually California, and so this is just showing that when states focus on it and make it a priority, they make a difference, and that's how they've turned their curve. This one, this is a lot of information. Look at the piece that says 156. Essentially, that's the large bulk of maternal mortalities are happening after that 60-day period after a woman's given birth. So after the 2-month period where Medicaid has ended. So majority of maternal mortalities are happening after women are losing Medicaid coverage. Another priority is improving consumer protections in the private market. So one is protecting consumers from surprise medical bills, where they go in an emergency to a hospital to get treatment, and the hospital's in their plan, but it turns out their anesthesiologist isn't, and they end up getting a big bill. There was some headway made on this last session, but there's more improvements that can be made in this area. Ensuring health plans have adequate provider networks. I think everybody knows this is an important issue for a lot of Texans. Increasing consumer protections on skimpy short-term plans. So this is part of, the Trump administration and many at the federal level attempted to repeal the Affordable Care Act, and when that failed, they've implemented a lot of new policies that have been kind of summarized as ACA sabotage, that little by little you weaken the infrastructure and the marketplace. Two that have gone into effect within the last year is the ability to sell plans that don't provide comprehensive coverage, and to sell them at a lower cost. So the problem with, we call them junk or skimpy insurance plans. The problem with those is healthy people may gravitate towards those plans because they are betting that they won't need comprehensive health care coverage, and it's less money for them. But that leaves more individuals with pre-existing conditions and other healthcare needs in a growingly pricier market. So there is work to be done this session to try to limit those skimpier plans in Texas. And ensuring that consumers can easily get accurate information about expected healthcare costs. And we have more information about all of this, but it's a lot, so I didn't include that here. This is a favorite of mine, implementing 12 months of continuous coverage for children in Medicaid so that they can avoid gaps in coverage. So of the 835,000 uninsured children in Texas, we talked that about 350,000 of them are eligible but not enrolled. Many of those children could be reached if we allow children to stay on Medicaid for an entire year, like we do in CHIP, like we have in private insurance, like we have in most other programs. But for some reason, it wasn't even through legislative action. When the ACA got passed, Texas interpreted the new rules as giving Texas the ability to do month-to-month income checks on families that enrolled their children in Medicaid. So a state law required one continuous 6-month period for coverage. So the state had to honor that, but for the second 6 months in the year, the state is doing month-to-month income checks on the family. Another problem is some families don't have their children all aligned on the same date. So imagine having 2 or 3 children with different start dates, now getting requests. The requests start in month 5 for month 6. So you get a letter, you may get a letter in month 5 asking to verify your income. You could get one month 6, 7th, and 8th if the electronic database that contains income information doesn't have your employer, if you've changed jobs, you know, any non-traditional or kind of big business may not have accurate information or complete information in the state's databases, and that triggers an outreach to the family asking them for more paperwork, essentially. We think this could be part of the reason that Texas's child uninsured rate is growing a bit faster than other states. And so the 2 priorities are, once children get on Medicaid, go ahead and give them 1 year of coverage, check their income, 12 months later. And the other is, can we get all kids in a family to have renewals on the same day? And this is the complicated slide explaining our complicated system in this. Alrighty. The next priority is improving the quality and access to care in Medicaid managed care. So most of our Medicaid program goes through Medicaid managed care, so the state pays health plans money to administer the Medicaid program. Some of you may have seen a series in the Dallas Morning News about a lot of really sad stories of children and other individuals not getting the care that they needed under Medicaid managed care. So that has created momentum this session to try to improve transparency, oversight, and appropriate provider input in processes. So if a family is denied a service and they make an appeal, can we make sure that a medical expert is making a decision about that medical appeal and it's not being done by an administrative personnel, or that an OB-GYN isn't making a decision for a pediatrician's decision on something that they just don't practice. So there's some surprising areas that require improvement in our system, but luckily there is interest and momentum for that. And then I'm closing with opposing federal efforts to destabilize the marketplace or reduce healthcare for Texans. In the last week, we've seen news that the Trump administration is going to attempt to essentially cut Medicaid again. This was a proposal that was included in the ACA repeal. I would say that after kind of the public outrage for pre-existing, removing the ACA generally from people, the second wave of outreach was about cuts to Medicaid, which again serve our most vulnerable population. So it is pregnant women, seniors in nursing homes, individuals with disabilities, and the large bulks, 75% at least in Texas, children. And so we need to be ready to mobilize around those issues again this year, I think. And these are just a few extra slides about some of the myth busters I mentioned before. This is the caseload growth for Medicaid. So you see when in 2000s, and I'm trying to remember, CHIP was formed right around there. Enrollment was lower. Children accounted for the large bulk in caseload growth. It really hasn't come from the other populations, and now it's stabilized, as we were talking about before, now that we've reached the majority of children in Texas who are eligible for Medicaid. This is to show that Texas has done a very good job of controlling costs in Medicaid. Our spending per Medicaid client has not risen very much since 2002, and if you adjust for inflation, we're actually paying less per Medicaid client than we did before. This is adjusted for inflation. You see the numbers going down, so we're spending less per Medicaid client. This is the comparison between the state budget, our general revenue, so just state dollars, and then the all funds budget. In the general revenue, so just the state budget, you see that 31% of our tax dollars are going to healthcare, and that's primarily Medicaid. And 38% plus the 14% is going to public education and higher education. So it's a much larger share than healthcare. So if anybody ever tries to tell you that Texas's highest cost item is healthcare, you can confidently push back on that and say it is absolutely not, it is education. What you're talking about is the all funds budget, because we get such a good deal for our healthcare programs. That is one of the best ways to bring our federal tax dollars back home to Texas. And that's what you see here on the right. So while we were 31% of just our state revenue budget, we are 37% of the all funds budget, and you can see the education pies shrink because we don't get as much federal matching funds for education. This is just another way to show that in the federal funds, we get lots more money back for Medicaid than any other kind of section of the budget. The next largest one is highway and construction, and you can see that's significantly less than what we were able to get for Medicaid. So a lot of the business community sees Medicaid as an economic stimulus for our community. It brings a lot more dollars into our state that goes to hospitals, providers, into our economy generally. Healthcare workers. Let's see here. This is, why did I decide to put this one? Okay, This is a slide from the Children's Hospital Association of Texas, showing that they are deeply dependent on Medicaid funding. So the left pie chart shows all hospitals except the children's hospitals, and the red pie piece is how much they depend on Medicaid. The right one is the children's hospital, and you can see that over 50% of their funding depends on Medicaid. So whenever you hear block grant Medicaid or per capita caps on Medicaid or anything that essentially is going to force a state to cut Medicaid, you can think cut children's health coverage, you can think cut funding for children's hospitals that we all rely on. You can think, affecting our economy, cutting Medicaid needs to be associated with all of these really harmful things for our community. And that is all I brought you today. This is my email. Anyone is welcome to email me with questions, especially email me if you want to be part of our healthcare network. And the websites I put here are Children's Defense Fund website, and also Cover Texas Now is a coalition of public interest groups that, as Lisa introduced before, that works on these issues. And we have regular newsletters that come out that will basically keep you updated on all healthcare issues. And there's regular blogs and things of that sort. So it's a great way to stay connected.
So can y'all see me on the Facebook Live there?
Okay.
So I'm joining Laura up here to talk about just a couple of things that are not, I guess to talk about them more from an Indivisible perspective than from a Children's Defense Fund or Cover Texas Now perspective. There are a couple of things already happening at the legislature with respect to some health care bills. And Children's Defense Fund has started, I think, a bill list of things that we're watching and tracking. And is that something we could make publicly available?
Yeah.
Okay, so that's something that we'll make publicly available so people can see, excuse me, the things that CDF and CTN are following. My representative is Gina Hinojosa, who in this room is represented by Gina. Shout out to Gina. She has proposed something that has not come back as a piece of legislation yet. There is not a bill, but it will be called the 2019 Healthy Texas Act. And it's essentially a goal of having a single payer healthcare program in Texas. I don't know very much about the specifics of it. I do have a little flyer here that I put together from some stuff from her website, but as soon as there's a bill out on this, I'm sure we'll share information about it from Indivisible Austin. But the goal of this is, sort of another way around that question of how do we get coverage for all Texans. And so this is one of the things that's out there. The other thing that looks like it was just filed this week is that Representative John Busey, who's one of the new representatives in Williamson County, has filed a bill to put Medicaid expansion on the ballot. And this is something that people ask us about a lot. How do we get Medicaid expansion on the ballot? Because people see these successful ballot measures in other states. And, we see now there was a successful ballot measure in Utah that the legislature is challenging. There was a successful ballot measure in Maine that the governor refused to implement, and that's underway now. But in Texas, we don't have citizen-led ballot initiatives, and so the only way that something can get on the ballot for voters is for it to actually pass through the legislature. Will it be politically palatable? Who knows? But this is something, at least, that I don't think has been tried before. Yeah.
No, not since I've been here.
So creative ways around the problem. So I wanted to mention those, and I also wanted to mention, if you don't have your copy yet, we have in the back Indivisible Austin's Guide to the Texas Legislature. If you're not a paper person, it is available online, but if you want to, something to sort of be able to flip through and hold in your hands, and the legislature is something new to you, we have these for you tonight.
Thank you.
Thank you, Lisa. Oh yeah, I'm so sorry. I'm so tired today. We had our big legislative briefing today at noon, and we also had a testimony on the census. So that's actually another really important thing that y'all might care about. Every 10 years, it's in the Constitution that we need to try to count every individual living in our country, and that year is 2020 for us. And the calculation of people living in each state is what's used by the federal government to calculate how much of our federal taxes get to come back to us for transportation, for Medicaid, for CHIP, for all of these different programs, for our education. And so states that undercount their population end up losing, tons of our federal tax dollars, sometimes to other states. Undercounting by just 1% of the population equals a loss of $300 million per year for the next 10 years. And even last time we counted, I think children were, significant. Children tend to be a harder to count population. We are a young state with a lot of children. Immigrant and blended families tend to be a harder to count population. We are a diverse state, so we have many aspects that already put us at risk of having an undercount. And with the anti-immigrant policies coming out of the administration, it's probably going to be one of the most difficult times in recent history to get an accurate count, but it will make it is a big deal and will make a big difference to the funding our state has to work with for the next decade. It also impacts how many congressional seats we have. We have the potential, for example, to pick up 3 new seats. And we always have the potential to lose some seats. And for our electoral votes during presidential elections are also calculated with this. So there's incentives for, I think, people of all political stripes to want to have an accurate count. And we were testifying today to ask for funding to invest in targeted outreach to encourage people across Texas to answer the census. California has just invested $90 million into that effort. Part of the strange part of this is when other states do a better job of counting their citizens, it actually puts states that don't do a good job in an even worse position. Because it's a calculation of distribution of funds amongst the states. Anyway, so we had a full day, census, briefings, and I think I knew today would be a little tough, but I'm going out of town next week, so this is the only time we could do it. And I really appreciate Lisa for her incredible leadership and all the work, and anybody who is watching this and here in the audience, you guys are unbelievable to be working full-time jobs and then be putting your time into these things that really matter because they are everyday people making them matter. And I think what y'all have accomplished in the last few years, you have shown the world, or the country at least, what is possible when people volunteer their time and get involved and make a difference. So as we build our grassroots campaign, we want to not only recruit healthcare leaders from your communities, but beyond that, just work in tandem with Indivisible chapters across Texas in trying to change the landscape for healthcare coverage in Texas over the next 4 years.
So I have a couple of questions. Could you tell me how the affiliation is between Children's Defense Fund and Cover Texas Now?
Yes, so Cover Texas Now is just a coalition with a lot of organizations who are members. My organization leads the Coverage Gap work group within the Cover Texas Now coalition, and it is generally public interest advocates that are in there, so groups like the National Association of Social, well, actually that's not an example of necessarily public interest. It's generally public interest, but a few provider types like the social workers who are very family centric are also part of our coalition. So the community health centers, the social workers, groups like the Center for Public Policy Priorities, Texas Care for Children, the Children's Defense Fund, faith-based groups like Texas Impact, the Texas Organizing Project, grassroots, so public interest groups. There's another coalition that's children's advocates that include the provider community, like the hospitals and the doctors and the health plans. Cover Texas Now was created around the time the ACA was being proposed because we needed really a way to move on supporting the ACA quicker than we were able to get, the broader coalition kind of on board for the ACA and for different kind of healthcare aspects. So we've been formed for probably
8 years.
2013, 8 years. Yeah.
So I was looking at the budgets that were presented out of the House and the Senate last week, and I can't remember which one, but I think it's the House. They have the biggest increase in the education budget that they're proposing, but they're funding part of that by a 10% decrease in Medicaid.
So Medicaid is underfunded every single session, and it is an entitlement program. So if a child qualifies, they have to get covered, and so the funding has to be there. So I liked it best when one legislator described it as that Medicaid is being used like a credit card. So we put some funding into it every session, but we underfund it by different amounts. And when the legislature meets 2 years from now and they're short things that they have to pay, like Medicaid, they pass that additional funding through a supplemental appropriations bill. It's not our favorite way of doing things, but that's how it's traditionally worked.
Isn't another reason though why that number is lower is because of the other thing with the FMAP that we were talking about?
So there's a few other things that are coming into play this year with the Medicaid funding, one positive and one negative. I hate to call it negative, but one that will decrease our Medicaid money and one that will increase our Medicaid funding. What will decrease our Medicaid funding is the Affordable Care Act gave, and I'm combining Medicaid and CHIP, gave CHIP a bump in federal match rates. So we used to get about 73 cents on the dollar. For the last several years, we've been getting in the 90s, like 93 cents on the dollar. We're going back to our old levels of 72 or 3 cents on the dollar. So that's going to represent more spending needed at the state level. At the same time, our matching rate for Medicaid is actually going up a little bit. It's called the FMAP rate, so it's just our federal matching amount that comes back. And the reason that is happening is it's a complicated formula that uses median household income relative to other states. So Texas's median household income has decreased relative to other states, and thus we're getting a bigger share of federal funds for our Medicaid program. So when you balance all that out, the numbers are a little bit, I think there's a little bit more cost, but it's not as much as there normally would be. But that doesn't, those are just some of the behind the scenes things, but generally the underfunding is coming because we always do that.
But I thought they were proposing, because this is different from what the Legislative Budget Board was saying that we were going to need. This is what the House was saying, we want to decrease Medicaid
Yeah, like $1.4 billion.
while we increase.
Right.
But they can't actually do that.
But you
It's just
can't
a budgetary
actually do it.
sleight of hand, just pushing it off till the next.
It sets us up for about that amount in supplemental appropriation needs for next session. And if you look, this session, we are also having to write our supplemental appropriations bill, and I'm trying to remember the number, but it's, you know, in the billions level, 1 or 2 billion that we're having to back pay, fill in the Medicaid shortage from the session before.
So what does that mean then? If it's gonna take the money and pay for
Yeah,
education,
you're
then I
right.
have to pay it back. How does that,
I suppose it's just a way to have a lower number for the budget, or to free up some money to spend it elsewhere, because they treat the kind of regular appropriations bill and the supplemental appropriations bill as different. So it's, some might say, an accounting trick to make things look smaller than they really are.
There do, I mean, I'm not a state budget specialist at all, but there do seem to be a lot of accounting tricks that they use. Our colleague Eva DeLuna Castro at Center for Public Policy Priorities is the state budget guru of our, you know, sort of statewide policy organizations. She's on Twitter like all the time. Okay, well, if you are willing to get on Twitter, she tweets about the state budget as things are happening. So as things come out from the LBB, as budget proposals come out from appropriations, Senate Finance, you name it, and she really goes through it in ways to try to help people like us understand what they mean. And so she does talk about the accounting tricks and sleight of hand as they happen. Eva, EVA, DeLuna, DeLuna, Castro. I think she's just Eva DeLuna on Twitter.
Right, Center for Public Policy
Center for
Priorities.
Public Policy
I got an
Priorities.
email with
DeLuna Eva.
with a link to her. You can read her
Yeah.
analysis and stuff.
So, sorry Eva, we just spammed you, but you're worth it. Any other questions?
This may be already covered in your grassroots coalition efforts that you've already got going.
It's just getting started.
Okay.
Yes.
If the best place that we can put our energies is at the grassroots level, to me that means I need to do more talking to people in my community versus focusing so heavily on the legislators. So some equivalent to an elevator pitch, do you have like doorstep talking points to explain to a civilian? You know, like I didn't know much about the difference between like Medicare and Medicaid and all that until a few years ago when my parents, you know, that became an issue for my parents. So I mean, at a very basic level, do you guys have sort of just doorstep talking points to explain what would be ideal and like where the pressure points are and what we can do?
Yeah, I think that we probably need to really think about being able to answer yes definitively to that. We have longer pieces, and in fact, here at the table when you entered, there's a document that's our narrative for this session. It's focused more on the legislature, I think, or grass tops individuals. But I think the grassroots message is something along the lines of, you know, nearly a quarter of working adult Texans or in our state don't have access to any kind of affordable health care coverage. And this is not only hurting them and their families, of which children are a part of, and kind of affecting the lives of children, but it's affecting a lot of issues that our state is dealing with that are really severe. The opioid crisis, substance use disorder, our rising rate of maternal mortality, and not having enough mental health care services. Texas could go a long way to fixing all of these issues if we would ensure that all Texans had access to affordable health care coverage, which our state can do right now by accepting Medicaid expansion dollars. It would, every expert that's looked at this has said it would be an extremely cost-effective solution. I don't know, something along those lines. We have to work on it, and I think that's what we would do with the grassroots group. I think your point about talking to neighbors is right on. One of my favorite speakers on this issue became a lifelong healthcare advocate after being asked to canvass a neighborhood and ask people 3 questions. One was, do you have health insurance? Do your children have health insurance? And what do you do if one of you gets sick? And the stories he heard just in the neighborhoods that he walked have stayed with him for his entire life and have made him a passionate advocate. I envision this grassroots campaign doing similar kinds of block walks, of connecting with community, of getting neighborhoods and communities to start talking about this issue that's one of the biggest issues that does impact families. If even one person in your family doesn't have healthcare coverage, your family is not financially protected. You can be, medical bankruptcy is, the most common reason for bankruptcy. We have, our child poverty rate is much too high, and often it's because families and parents are lacking these services. So, but yes, if those are the kinds of questions you're asking yourself, please become part of this healthcare network.
I am shocked that the median income in Texas has declined vis-a-vis other states,
Yes.
even though we have an economic miracle in Texas.
Vis-a-vis other states is right, because it could have been that it stayed the same or even went up.
Yeah.
But compared to other states, we're looking worse. Texas does tend to have a higher unemployment rate than other states, but we have we tend to create jobs that are minimum wage or low income jobs. Yeah. And as I said before, a single mom that can only have part-time work, 11 hours a week, her child might have a healthcare need or whatnot. She would make too much to have healthcare coverage for herself. So very quickly, the majority of individuals in the coverage gap where the parents don't have access to healthcare coverage, or the adults, are working. Yet, we have more jobs in Texas than the national average that do not offer health insurance. So all of that contributes to a very high population of working adults who don't have access to healthcare coverage. So I think story collection, I think block walks and talking to neighbors, my dream sometimes is, could we collect more signatures for a petition as other states that did get the Medicaid expansion on their ballot as just a sign of public demand and protest. I think, if candidates running for the next election see this kind of activity, they're going to be more prone to lead on this issue, to talk about this issue. We just need to get Medicaid expansion to be seen as a winning issue for people, or at least a necessary issue to be talking about. And if it's not comfortable to talk about Medicaid expansion in any one community, talking about just our high rates of uninsured and our growing rate of uninsured, and what's that doing for women's ability to access care and, you know, not be a victim of maternal mortality. Another colleague of mine often says that maternal mortality is only the peak of the tip of the iceberg. For every one woman who passes, in that year after birth for pregnancy-related issues, 50 of them experience a morbidity around it. So, unfortunately, this is another issue, and that and the opioid crisis are issues where more and more of us are knowing somebody, that is experiencing these kinds of issues. And the lack of access to care is really impressive. And then, of course, the mental health issue, there's just not enough services. And now that so many other states have expanded coverage, we have lots of data and lots of examples that show that when people have coverage, their access to mental health services, substance use disorder, treatment and recovery service just goes up exponentially. Individuals do need this care, they do want this care, and when they are able to have coverage, they go get the help that they need oftentimes. And we just need to be able to give Texans the same opportunity that other people are having in other states in this country.
So most of the Indivisible groups are organized around congressional districts, and the one that I'm in, 25, has a lot of rural counties in it. And so we already knew that the hospitals closing would resonate in the communities out in those counties. Is there any other issue that you think would resonate with them in particular, or is there a source for information that you like?
The rural hospital closures is a really important one and motivating one to use in those communities, because it's, unfortunately there are the stories are already there of the human impact for that. The other one that's interesting is just general support for Medicaid. Rural communities tend to be more reliant on Medicaid than urban centers, because more of their population qualifies, their children qualify for Medicaid. Their hospitals' budget have a lot less wiggle room than urban centers, so any cuts in Medicaid or funding that starts decreasing little by little can have a big impact on hospitals. I'd have to think, those are the two that come to mind the most. The census count, just as an FYI, another hard to count area does tend to be rural communities.
Can I add something?
Yeah.
So it's still a hospital issue, but it's not necessarily a hospital closure issue. One of the things that some rural community hospitals have had to do in order to keep operating is to close certain departments. So there are community hospitals that don't have the full range of hospital services, including labor and delivery. So in Bastrop County, for example, there is no hospital that provides labor and delivery. Every woman who lives in Bastrop County who gives birth, for the most part, gives birth in Travis County. So when we're talking about the healthcare infrastructure, right? It's more than, it's sometimes more than the things that we think about. So, I mean, everybody, I would get, well, maybe not everybody, but many of us have driven that stretch, right, of 71, out to Bastrop, Birdall's Pecan Farm, and what have you. Think about how far that is from your Austin home. I live near the Seton on 38th. So if I had to drive in, right, from Bastrop, if any, you know, for anyone, we're talking a 30-40 minute drive for many women to deliver. And that's a story that's true across Texas. It's not just Bastrop County.
And rural hospitals are important to all of us. Any road trip that we are on, if we should have a medical emergency and there is no nearby hospital. So it is an issue that, you know, all Texans should care about. There's an organization called, I want to mess it up. Their acronym is TORCH, Texas
Organization for Rural and Community Hospitals.
That's it. That's it. It's been a while since I've said it. You know, but they talk a lot about these issues. The trick, I think, with any subpopulation is resisting the desire to develop a unique funding stream for just one particular piece of this issue, is a way to avoid, again, providing, you know, properly funding Medicaid or doing Medicaid expansion. So doing Band-Aid funding for rural hospitals, or, you know, small programs for substance use disorders and mental health. And we support a lot of those because, you know, we're going to support whatever incremental improvement we can do in any of these areas, but it should not allow us to lose focus on what Texas really needs, which is just for everyone to have access to
universal health care for all.
Small, tiny little. Any other questions before we wrap up? All right.
Well, I have one more.
Oh, that's fine. Sure,
But
that's fine.
it's a toughie. I mean, Indivisible was instrumental in pushing back on the ACA getting repealed, right?
Mm-hmm.
I think in some ways that was easier than this death by 1,000 cuts.
Mm-hmm.
Do you have any advice on what we can do?
The ACA death by 1,000 cuts. It is exhausting. Working in this field, it's every single week or every 2 weeks, you know, another hurtful policy gets made. And what we're, you know, what we're doing is just pushing back as much as we can on every one of them. A lot of these proposals are new rules that allow states to apply for waivers to do a lot of this bad stuff, and so that is a leverage point for state advocates, is just keeping your state, our state, from applying for these waivers and these exceptions, advocating to states to mitigate harmful things. Like the Texas Legislature can do things to limit the junk insurance plans here in Texas. That is our opportunity to advocate at the state level for harmful policies that are coming from the national level.
And is that something we would talk to our legislators about, or do they have control over that?
Yes.
About applying for waivers?
Yes. Our state legislature gets to direct our agencies of what waivers to apply for, and can also create rules and policies on how certain federal rules can be applied here in Texas. So I'm sure y'all will get our Cover Texas Now legislative priorities, but in there it'll talk more about junk plan, you know, the skimpy plans, and what Texas could do to help mitigate the potential harm from those. So each one is kind of unique. The public charge rule, that's creating fear throughout the immigrant community with a lot of different leaked information about the rule that wasn't actually ultimately in the final rule, but served to make people really nervous, and a lot of too many families from immigrant communities are dropping their children from Medicaid and CHIP. You can only qualify for Medicaid and CHIP if you're a citizen or a legal permanent resident. The majority are citizens, so citizen children are losing their health care coverage because of a lot of these policies. So for that one, the job there is to get information out to the community, let them know that rule has not gone into effect. It may take a long time for it to go into effect. It may never go into effect. So there's no reason right now to drop their children from health care coverage. If something were to change, it would be looking forward, so it wouldn't be retroactive. So families would have time to act. And that the rule, even as written today, is a lot more limited in scope than what they may have heard before. So it wouldn't penalize an individual because their children used a program that they were eligible and qualified for. So a lot of those details, if you get connected to us on Cover Texas Now, we'll get all this information as we come out with it. And and if you end up being part of that, our healthcare network, we'll get you this information kind of on a regular basis, but mostly we'll be talking about kind of organizing strategies for local communities and making sure that you all have the resources and feel empowered to start connecting with with your community on this issue. A lot of good questions. Yeah.
There are just so many days. It's like watching ACA get kind of shredded. But I worry sometimes that it may take something like that happening for there to be even more push for universal health care. I don't want to see that happen. That's a lot of people are going to get damaged in the process.
Can I say something about that?
Yes.
So, watching the news and hearing, all of the death by 1,000 cuts, right? Hearing all of these, sort of things that are working to chip away at the ACA. These are ultimately things right now that are happening around the edges of the Affordable Care Act, right? Nothing yet has struck at the heart of the ACA. The heart of the ACA, the solid trunk of it, is still there. There are branches that are getting, hacked off here and there, but the core of the ACA is still standing. And that is something that's a testament to the work of people like us in this room. And we may lose some of these things around the edges right now, but I would encourage everyone to take to heart that the ACA is still standing because of the work that we have done. And I would hope, I think it is sometimes hard not to get discouraged, but at the same time, I think we have learned over the last 2 years all of these different ways that we can take action, right? Whether it is showing up at a member of Congress's office to talk to them gently or otherwise about these issues, to writing comments on proposed rule changes, to galvanizing others in our communities to write comments on these proposed rule changes, which may feel like a small thing, but that drop in the ocean of how many comments were submitted on the public charge?
Over 200,000.
Over 200,000 comments on the public charge, right? All of those things together lay the groundwork for people to be able to challenge these rules in court and keep them from standing. So it's civic education 101 every day. But yeah, so it can feel terrible. I know it can feel terrible, but there's a lot that we have acted to protect.
And that was said beautifully. And just as a reminder that in the last ACA open enrollment that didn't have the mandate, so one of the cuts, there was only a 3% drop in enrollment here in Texas. So that's part of what's going to challenge the court's ruling on the Paxton lawsuits about pre-existing conditions. That, that part of the judge's argument was without this critical piece on the mandate, the whole thing falls apart. But enrollment just proved that it actually stays standing and strong despite the mandate. So, we're doing a lot better than a lot of people would have predicted, a few years ago. So we just have to keep doing it. Yeah.
Thank you so much. I'm
Thank you.
coming in here to do this despite being so tired.
I would love
I really
to
appreciate
come
it.
back and do this one day when I've slept.
Your batteries are
And
charged.
y'all can see me a little bit livelier, and but I hope that you were able to get information, the kind of information you were looking for.
Well, thank you, Laura, and we're going to hold you to that.
Yes,
Maybe
I would love
we'll
to.
do a mid-session briefing once we see what sorts of things are moving, how, do a little check-in on some of these priorities, and, see where we can keep taking action.
Yeah, wonderful. We're in it together.
Thank you.
Thank you,
Thank
everybody.
Why is democracy so hard?
What's that?
Why is democracy so hard?
It's the worst form of government, except for all the others, right?